Hello, my name is Kayla Chapman and I'm going to be demoing your IV removal and insertion checkoff. So you're going to show your badge, and I have reviewed my physician order and have gathered my supplies. I'm going to knock on the patient's door, introduce myself. Hello, my name is Kayla and I will be your nurse today. Can you confirm your name and date of birth? Okay, do you have any allergies? All right, I am going to provide privacy, do hand hygiene, and explain the procedures to the patient. So I'm here to remove your IV and replace another one. Is that okay with you? Patient says it's okay. So now I'm gonna just raise the bed and make sure my patient is comfortable. Are you in any pain? Patient's not in pain. And so I have my supplies here. And so since I'm starting off with the removal, I know that I need tape or either a Band-Aid and a gauze. And I'm gonna go ahead and get everything else out of my way. If you would like to use an alcohol pad, you can. Your patient will appreciate you a lot better if you use one, especially if they may be hairy. So I've already done my hand hygiene. I'm gonna don my gloves. And so if I decide to use an alcohol swab for the removal, you're gonna always start here at the end of your catheter. So I'm gonna go ahead and take the tape off that is securing my tubing. I'm gonna start back here, and I'm still supporting the catheter and removing the tape. And I'm just gonna pull away from the skin and go in a circular motion, because the last thing that I want uncovered is the actual catheter insertion site. So I'm moving in a circular motion here. And so now that I have everything uncovered, I'm gonna grab my 2x2 gauze, and I'm gonna place it right over my insertion site and pull it straight out. And I'm gonna hold pressure here. I'm gonna make sure that my catheter is intact. And I'm going to hold pressure until my patient stops bleeding. So that may be 2 to 5 minutes. It may take up to 5 minutes if your patient is on a blood thinner. And I'm going to dispose of this in the sharps. And I'm still holding pressure here. And this is when you can grab your tape or your Band-Aid, and then you're going to secure the gauze here. So that completes the removal. I'm gonna go ahead and clean up my area, clear out my space. After your removal, if you feel like this dressing may interfere with you doing your insertion for the IV, you can go ahead and get rid of it. So I'm gonna get rid of mine, and I'm going to take off my gloves. I'm going to do hand hygiene. And now I am going to apply my tourniquet to see which vein may be best for my patient. So I'm gonna make sure the tourniquet is within 5 to 15 centimeters on the arm here. And I'm always gonna start distally. So I'm looking for a vein here. I'm gonna palpate. And this vein looks good. So now I'm gonna pop my tourniquet while I gather my supplies. And for my supplies, I have my 10 cc flush, I have my J-Lube, my Tegaderm, my angiocath, which is the IV, and my connector hub. You'll also need an alcohol swab. So I'm gonna have to make sure that my Tegaderm or my transparent film dressing is out of the package. So I'm gonna place that there where I know I can be able to easily access it with one hand. So now I'm gonna open up my J-Lube. And then open up my connector package. Gonna get rid of that. I'm gonna grab my tubing and I'm gonna replace this cap with my connector piece, and I'm just gonna replace it blue on blue. So I'm removing the blue standard piece and then I'm replacing with this blue one. Now I'm gonna go ahead and connect my saline syringe. And again, my tourniquet is not on my patient while I'm gathering all of my supplies. And then I'm gonna pop this cap off. And I wanna make sure that I maintain sterility inside of this cap. I'm gonna prime it, making sure I'm priming it straight up. Okay, it's primed. I'm gonna stick it back here in the package, still maintaining sterility. And I'm gonna keep it close to me, so again, I can grab it with one hand. So now I have my transparent film or my Tegaderm out of the package. I've primed my J-Lube. I have my alcohol swab and my needle. I have everything ready to go. So now I'm gonna reapply the tourniquet to my patient. Again, I'm gonna verify that this is the vein that I will do my insertion with. And I'm gonna go ahead and don my gloves on. Now I'm ready to clean the area in a circular motion here. I'm gonna let it air dry and grab my needle. I am making sure that my bevel is up. I'm gonna warn my patient that they may feel a sharp pain. I'm gonna support the vein with my thumb 4 to 5 centimeters below my insertion site. And I know that I can go in at a 10 to 30 degree angle. So I'm gonna go straight in here. And once I'm about halfway, I'm gonna verbalize that I see flashback in the chamber. I'm gonna lower the catheter and the needle, and I'm gonna make sure I only advance the catheter. At no point am I advancing the needle all the way into the patient's vein. So I'm only advancing the catheter here. And once I advance this catheter fully, I'm going to have to support it until I put the Tegaderm on. So I'm supporting this here. I can apply pressure about 4 to 5 centimeters above the insertion site. And so I'm going to withdraw the needle. I'm going to put it in the sharps container, and I'm going to pop my tourniquet. Now I'm going to grab my J-Lube. I'm gonna connect it, and at no point am I on top of my insertion site. So now that I have that connected, I'm gonna relieve from holding pressure here at the top of the vein, and I'm going to flush it with 3 mLs. As I'm flushing it, I am assessing the site for any infiltration, so any pain. swelling, redness that may occur. If that does occur, then that means I would have to, your IV is not in the vein. So I'm still supporting it here. Now I'm gonna grab my Tegaderm. And at this point, this is when I will be able to move my hand as I'm applying the Tegaderm. So I'm gonna remove this outside layer here. I'm going to clamp my tubing, disconnect my saline flush, and I could either support my tubing with a piece of tape. However, I'm going to use the tape that is already included in your Tegaderm, on your Tegaderm package. I'm gonna make sure I date, time, and initial, and support my tubing here. And there's my insertion. So now at this point, I'm going to clean up all my supplies, lower my patient's bed, give them the call light, make sure that they're comfortable. I'm going to remove my gloves, do hand hygiene, and I'm going to then do my documentation. So I'm going to document where the IV was inserted, any assessment at the site, and how the patient tolerated the procedure.